I am Dr. Prinky Talley, Cavey Chiropractic, Allison Park. Today talking about carpal tunnel syndrome. Carpal tunnel is a very common problem now with people working at computers on a very regular basis. And what happens is that one or more of the bones in the wrist gets slightly out of place, or maybe more than slightly, and it'll begin to pinch the nerves as they're passing through what's referred to the carpal tunnel. It's an area between all the bones, surrounded and wrapped in ligaments, and it's possible that things get pinched in there. And then we can have things like pain and numbness and tingling in the hand. And of course, that can be inconvenient. So chiropractic can help with carpal tunnel syndrome by realigning the bones and removing the pressure from the nerves. And it's also advisable to add some stretches and exercises to help, and things you can do even in advance of chiropractic care, but certainly in conjunction with, are stretches and exercises for the hand and wrist, where you just apply gentle pressure in a normal range of motion, first flexing and then extending the wrist. And then you can also medially and laterally deviate the wrist, pushing gently against and stretching things out there. Now, it's also possible that the problem is originating in the neck. Over my shoulder here is a chart that shows nerve dermatomes, and that's an area of the skin that is supplied by a particular nerve, and the chart shows where it exits. These nerves that exit here at the neck and go down the arm to the hand can be pinched back in the hand, and people then experience carpal tunnel-like symptoms. So at Talley Cavey Chiropractic and with my patients, it's very important to me that we understand exactly where the problem is coming from so that we can fully address it at its root and correct the problem, whether it be just specifically misalignments of the bones of the wrist, or if it's a pinching of a nerve at the neck. We need to know which in order to know which way to treat and then get rid of the problem. If you are experiencing carpal tunnel symptoms, please consider chiropractic. Schedule an appointment, get evaluated, especially in advance of surgery. Unfortunately, over the years, I've seen plenty of patients who had carpal tunnel surgery with absolutely no change in symptoms because the problem wasn't in the wrist where the surgery was, but it was in the neck. Now, we were able to resolve it with chiropractic care and adjustments to the neck, but the surgery was clearly unnecessary as it had no benefit. So chiropractic first, and then if we come into a case that we can't solve with chiropractic care, leave those other more invasive options for later. I hope to see you soon. Thanks for watching.